Oops, about that. So one of my favorite quotes that it feels so relevant to our work is that your life's work begins when your great joy meets the world's great hunger. To me, this sort of sums up what we're doing, is matching our joy with the babies out there, the families out there that need our help. And another quote is, if you can't feed 100 people, then let's just feed one. So that I just wanted to put those little inspirational words out there for you. So there are 34,000 lactation consultants around the world, and about 18,000 of them live in the US. And you might wonder, well, is there going to be enough work for me? Well, there were 3.7 million babies born just in the US last year. So I'm hoping that we can get more lactation consultants spread out more evenly than is going on right now. I was looking up the state by state, and there's some states that have quite a few, and some that don't have as many. So that could be something to think about. How can I take lactation consulting to people who don't have as much? So where do people take their lactation certification? Some folks work in public health. Many people work in the hospital, helping babies as they're just born, or maybe in the NICU, or as some babies come back for various reasons. There's a lot of lactation consultants that work in the OB practices, or maybe in a pediatric office. We know many LCs in private practice, community organizations that work for WIC and milk banks. We have a little bit of representation from many of these same things named here tonight. So there's also folks who use their lactation certification not directly providing services as a lactation consultant. Maybe it's a pediatrician who wanted to get that extra depth of knowledge, or an OB who also wanted to get the extra knowledge, or maybe a researcher in nutrition would add that to their bank of degrees. So here's one possible progression a person might take. They may become a peer counselor, meaning they've breastfed their own child and then want to be able to share their experience and some additional learning with others. Or maybe they're already a doula and then they sort of get the lactation bug. Some folks then continue to get certified as a lactation educator or breastfeeding counselor, and that takes so many hours. I'm going to say 100, maybe more. Somebody can drop that in the chat as well. Or then after that, decide to take the next big step to becoming an international board certified lactation consultant. So here's the 3 pathways. I'm not going to linger long in here because that's not why you're here, but know that there's 3 designated ways nowadays for a person to become a lactation consultant. And we all need clinical experience in order to qualify to take the exam. So pathway 1 is for folks who are already working with breastfeeding families as part of their job, and they need 1,000 hours. Pathway 2, they use a university accredited practicum, and they would need 300 hours. And pathway 3, folks find an individual mentor, and they would need 500 hours. So as our speakers go on tonight, you might mention a little bit about the pathway you took and why. One thing to know for folks who are not already a healthcare professional, there are some prerequisites that may take a while, or maybe it's a slow build that you've already been working on. But know that these are prerequisites to beginning your lactation journey. So if you decide to continue with us or find out more about our program, what we're proud about is we have a high exam passing rate. We have very knowledgeable yet accessible teachers. We are affiliated with many of the hospitals and organizations in our area. And we have lots of options and scholarships and an ability for you to do this at a distance if needed. Okay, without further ado, I am going to start with introducing Veronica Lopez Erickson, who has an RN as well as her IBCLC. She's always had a passion for helping birthing people to have a healthy start with feeding their newborns, but in order to increase the depth of her breastfeeding support, she began to pursue getting her IBCLC. She took her exam in 2021. She currently works as the interim manager for Multnomah County WIC, where she advocates for culturally specific breastfeeding support. So Veronica, at this point, I would love to turn it over to you and tell us a little bit about what's a good day for you on the job, how you got started, what people would be surprised to know, those kind of things. And I'll give you about 10 minutes if that's okay.
Okay, thank you. Hello, everyone. Good evening. It's nice to be with you tonight. I'm Veronica Lopez Erickson, and I go by Ella, she, her pronouns. I am the interim nutrition programs manager for Multnomah County WIC services. I started my lactation career as a nurse, a public health nurse, do in-home visits and working in our community around Multnomah County, visiting our low-income mothers and families, seeking some home visiting services from community health workers and nurses for prenatal education and support, and then postpartum newborn care and support as well. A lot of my work has been in our diverse communities, so I identify as Latina and I speak Spanish, and so mainly my communities that I serve are Spanish speaking or indigenous from all over Latin America. And I also had the honor and opportunity to work with other diverse populations different from my own. I had clients and families from our immigrant and refugee populations, and as well as our indigenous, Native American, Alaska Native communities, and our Black African American families here in Multnomah County. Most recently, I was with Healthy Birth Initiatives, culturally specific home visiting program for our Black African American families who live in Multnomah County, encounter the racial health disparities that you might have heard about, our maternal mortality and morbidity, as well as our infant mortality and morbidity rates significantly higher for our Black African American families and our Native American families. And so that's part of my background and my passion for providing lactation services out in the community. It came from a personal experience with my own children. I have two teenagers, so hence the some of the gray that's coming in. So I have a high schooler and a middle schooler, and back in the day, as they like to say, back in your day, Mom, back in the day, I felt that the workplace even though I was a community health nurse, we were promoting and supporting lactation out in the community, that I myself, as a Multnomah County employee, did not feel supported with my lactation goals in the workplace. And I felt that, being a working mom, and a lactating mom, I needed to find quiet, safe, and clean space to either nurse my baby or pump for my baby. And I was told, well, there's the bathroom. You can do that there. Or here's a maintenance closet that's private. Or here's another office, but didn't have access to a sink or anything like that. And it certainly wasn't clean. So after my experience of being kind of carted around the different rooms or spaces that I knew were not adequate, were not appropriate for nursing or breastfeeding mom, I became an advocate for that, an advocate as lactation support in our county, and worked with other colleagues to create a more baby and breastfeeding, chest feeding friendly spaces, workplaces in our county. And we started our employee resource group, and we called it Family Advocates of MOLTCO, or FAM. And we really advocated for safe, clean, private spaces throughout our county buildings, to have a designated lactation room. And part of that, sparked that interest to learn a little bit more about why is human lactation so important, so crucial for our health and well-being of our children and the families that we support. And I came to PSU and studied under Ms. Dixie, and completed the lactation courses. I did receive some help, so there is financial scholarships and financial support available out in the community. And looking, be sure to look into resources that will help you. And I am very grateful for that financial help. I received a scholarship from PSU, and a scholarship from Oregon-Washington Lactation Association, AWLA, to sit for the exam. So I'm a scholarship recipient, and I know that couldn't have completed this journey without that support and that financial help. And when I sat for the exam, that was September 2021, right in the middle of COVID. So it was a virtual exam, proctored, and always nervous for an exam like that, and happy to receive the results. And I had been working with families throughout taking the courses. I continued to work with in-home visiting, supporting families, and grateful for the opportunity to bring some of those case studies to class and to share with my fellow students about what I was seeing in the community, how we could advocate. And I feel that this profession, this certification, really elevates us to become that voice for advocacy, that we can use it absolutely to work with individuals one-on-one. And the other piece of that, I think, to be true to the spirit of an IBCLC, is to advocate for more support, write to our legislators, testify, bring testimony about what our families encounter in the medical settings or in healthcare settings, as well as in the workplace. And proud to be a part of that advocacy group to bring those community voices to be heard about how we can continue to support families as a state. We have made many, many great strides in terms of parental leave, really enhancing that 6 weeks paid leave. Some employers provide paternal leave, but we can do better. We should always strive to do much better. We still despite all these great efforts to lead legislation around supporting families as a nation, we still fall so short. My own home country, El Salvador, offers up to 12 months of paid parental leave for both mother and father to be home with the child, have family support, have employer support, and we fall short of that. It's 6 weeks is hardly anything to make sure that we're bonding and nurturing our infants from the time they were born. And so I believe in that, and truly having this certification elevates us to, anybody can raise their voice and speak up for families and speak up for what we know is needed to support families in their lactation goals. And so now currently I find myself as working for the WIC program, Women, Infants, and Children, as it is known in the community, but it is a special supplemental program for women, infants, and children, providing nutrition, education, and lactation promotion and support for families who are low income. And it's been a great journey to learn about WIC and the services that we offer. We've certainly had to pivot in these post-COVID times or during COVID to from in-person services to virtual services. And in the summer, we are transitioning back to on-site work and welcoming families back into our clinics. So we're in the middle of planning and implementing some of those steps to gradually guide our families back to clinic services and appointments. And so this is a supplemental nutrition service, and families receive food benefits on a electronic card, like a EBT card, and as well as breastfeeding, chest feeding, lactation support from our peer counselors. And so we have a team of 6 peer counselors, and all identify as people of color and represent the communities that they serve. Very proud to have be part of that hiring for diversifying our WIC staff. And our WIC staff themselves, they speak over 36 languages. The community that we serve speaks over, I think it's 114 languages just in our county. And so that we definitely need more bilingual people in nutrition education, in breastfeeding and chest feeding support. And I'm very proud to be a part of that with this certification, to be able to advocate for WIC to be a part of that integration of lactation support for our participating families. And now just today or this week, receiving an email about how WIC itself, the National WIC Association, is offering scholarships too for people who are pursuing their IBCLC or who would like some financial support for the exam. So there's opportunity and there's resources available. And I'm glad that you've joined us tonight to hear more about that. So thank you for letting me share it.
Thank you, Veronica. Do you happen to have a couple words of advice for folks that are sort of in the pre-contemplation stage? Like what do you think would keep a person going on sometimes it feels like a long, curvy journey to the certificate, what would you
Mhm.
say?
I would say that, draw from your personal experience if you are a parent or an auntie to a young child or an infant, draw from that experience and find your motivation, find the motivation to continue. Because it can be a long journey, it can be a daunting journey, especially balancing work um, and studying and then your family life. And I think part of it is finding that motivation, finding those inspirational quotes and putting those in your calendar. What I found too is that to get a kind of a year calendar, January through December, to kind of either put up on the computer or on the wall, and just kind of set these small goals. It can feel really big, looking at all these courses that I have to take in order to get there. But if we list them all out and set these small goals, like this quarter or this term, I'm going to do this class. Even if it's just one class, you're at least, you're getting that much closer. This quarter, I'm going to read this article, or this week, I'm going to do this one thing. So setting those small goals and envisioning yourself in a completion, getting from A to B, finding your motivation. Those are my tips for success.
Thank you. Thank you. So for all of the participants here, Veronica has other obligations this evening. So if you have a burning question for her about her story, either drop it in the chat or turn on your mic and ask her. Give me a few seconds.
I'll ask a question really quick.
Great.
In our lactation education course, we had to research the WIC programs last term, and we appeared to struggle to reach some of the people who would support us or other moms on their journey. Do you have any recommendations for that or guidance, just so we know?
Sure. So I understand you're reaching out to some of our staff here at Multnomah County WIC.
Yeah, each of the different WIC programs. A couple of us did Multnomah County, a couple of us did Clackamas County. So just trying to better understand how we can, better serve our community too.
Sure. Well, we are a busy county, and there's one phone number which is open to the public or to our participating families. But now you have a direct line. You're always welcome to email or call. And I'm happy to share, my email, my phone number. Definitely have a direct line. Happy to share resources or just support you in your journey. Absolutely.
Thanks, Veronica. Yeah, I was just curious because we learned a lot about helping people through the WIC program, and I thought it was really unique and neat to learn about WIC and all that you do. And yeah, not many people for the amount of people that you're serving.
Yeah. We have a caseload of 15,000 families with a staff of about almost 50 staff. And not all of those are, WIC certifiers. And so you can imagine, phones ringing in our call center. We are definitely having to pivot to that, to respond as quickly as we can and as culturally responsive as we can as well. But absolutely, anyone's welcome to reach out and say, oh, I just need this, or can you direct me to a supervisor or a staff person? Happy to do that.
Thank you, Veronica. It's been so great to have you with us tonight. And thank you for dropping your contact information in the chat. And I see now why you might need the end of your day with 50,000 people.
Yeah.
Great. Well, thanks again for joining us. Stay as long as you wish. And we're going to turn next to Sonia Brown.
Sounds good. Thank you so much.
Thanks, Veronica. So Sonia is a registered dietitian, and that's where she began her career on her way to becoming a IBCLC. She studied lactation at our predecessor program, which was located at Portland Community College, and she became certified in 2015. She is the donor engagement manager at Northwest Mother's Milk Bank, and I'm sure she's going to tell us all about what that entails. And she's been there for over 8 years. And fun fact I learned about her, she speaks French and knows a little Japanese.
Oh, where did you hear that?
I read your LinkedIn.
Oh, wow. Okay. Hi, I'm Sonia, and actually the milk bank opened 10 years ago this August. So I've been there since they opened. And as she was saying, I have been a dietitian for 30 plus years. I've worked in a variety of environments, on a military base overseas, in a couple of different hospitals. And I just got to a point where I thought, I'm looking for something different. But I still love nutrition, all parts of nutrition. Life begins with nutrition. And so I was trying to figure out what could I do, still using my nutrition background. And I had a very challenging pregnancy, so personal experience, I guess, kind of got me thinking about this. And I had very little that was on my birth plan, lots of complications. But the one thing I knew I wanted to do was to breastfeed my baby. And I'd never heard of a lactation consultant, and all odds were against me. But this person came in my room, and she was a tough love type of gal. And she got my little jaundiced premature baby latching, and I was just amazed. And she nursed for 4 years, and I wish I had taken that woman's name, because she made the one biggest dream come true for me, and that was to nurse my baby. And so that had always been in the back of my mind. And so when I was thinking about what did I want to do at this point, it was actually my ex-husband, of all people, who said, "You really loved breastfeeding so much. Can you get a job helping women with that?" And I thought, I don't know. So somehow I'd heard about the lactation program at PCC, and met Dixie. And while I was taking my coursework, she said, there's this place, this milk bank, that has a grand opening. You should go and check it out. And so I went to the grand opening. It was outdoors. It was a beautiful July day. There was music. I was listening to stories from families who had received donor milk. And I was just really enthralled with it. And everybody there was just so nice and so loving and so warm. And so I applied to be a volunteer that week. And so while I was going through the program, I volunteered, and then I actually got hired, and I just never left. it's kind of hard how to describe it, but the milk bank is it's a nonprofit organization. It started with like 5 people. My office was in a supply closet. And we've grown to like 25, 26 people. And a lot of us are still there from the beginning. The old timers are anyway. And it's the environment. And that was one of the things that I was thinking about what I wanted in a career, because I'd done a lot of other jobs besides being a dietitian. And it was just the warm environment and how everybody works so well together. It was really hard to leave. And so I've been here for almost 10 years now, and I've done almost everybody's job in the milk bank, at least for a day, because that happens in a small environment like that. And so, you know, I had a lot of the skills from being a dietitian that worked really well with what I did by screening donors. So a big part of my job the first few years was talking to mothers on the phone who had a surplus milk and wanted to see how they could share that with other families. And so it requires a lot of listening, a lot of compassion and empathy. We have mothers who call who have lost their babies, and that's how they end up with a surplus of milk. So these were a lot of the same skills that I used in previous jobs. So that part came pretty natural for me. And I already had the medical background, the pharmacology, anatomy, and physiology. So when they would talk about a health condition or a medication they were taking, I usually knew, enough about it. And so, I spent, I would say, almost 8 hours of my day listening to mothers. They would ask me questions about breastfeeding, about how to store their milk, how they should, how often they should be pumping. So even though my role there was not being a lactation consultant, I have been able to have small conversations with them. And then over time, we grew so much that we needed more people to help me with the calls. And so we hired a couple of people. We also have a couple of nurse lactation consultants who are retired that make the calls. And so we get about 180 calls every month. We don't have to go out and find people to find mothers who want to donate. We're just in a wonderful breastfeeding community in the Pacific Northwest where mothers share this information, strong breastfeeding community. We're constantly answering the phone and having to call somebody back, always within about 24 hours, but we're really busy. And so now I manage the other donor screeners. And during COVID, we couldn't see families anymore. That was kind of sad. We missed seeing babies and mothers bringing in their babies when they would drop off their milk. But we were still able to see families a little bit because during COVID, many mothers were not able to get in to weigh their babies. Clinics were closed, they were short-staffed, all the reasons why it was difficult to see a healthcare provider. So it was really nice to have a mother come in and we could offer her to use our scale, talk to them a little bit about how they were pumping. So we still got to sneak in a little bit of lactation counseling with them. We had just started to open it was our very first baby cafe when COVID hit. So that's an opportunity for us to have mothers and their babies come to the milk bank and spend time with other mothers, and just be able to share their knowledge with each other, have a place to come and kind of hang out. So hopefully that's going to start in the fall. So there's always a lot of ways that I can still use my lactation experience, my personal experience, as well as what I learned through the program at the milk bank. We also have students come through the milk bank, so that's always a nice little something different. So like I said, it's a very small place. Most milk banks do not require a lactation consultant to screen donors, but ours does, and it allows us a little more independence and autonomy to be able to share our knowledge with who we're talking with on the phone. So my day has a lot of variety in it. I can end up, if I have to, not that often, but sometimes I have to check in milk. Sometimes I have to pour milk. Sometimes I have to pack up a box to ship out to an outpatient. So I learned a little bit about everybody's job, and they learned something about what we do in my department. So we're really nice big family. And I think that was part of what kept me there. And, I was a single parent when I started at the milk bank, and having, Monday through Friday, 8 to 5 job, that I wasn't crossing the bridge in bad weather. That meant something to me too. And so it all worked out somehow. It all became a perfect fit. And I still use my lactation experience and information every day in my job. We also rent out, we have pumps that we rent out, the Medela pumps. So that's another opportunity to spend a few minutes with a mom who maybe didn't get quite the information she needed on how to use a pump in the hospital. So we can spend time with her, and it's free to her. And so that's an opportunity for her to feel like, oh, I can sit here and take up this person's time, because I had all these other questions that I couldn't ask my provider. So we are a nice little resource for mothers in the area. And the three of us who do most of the screening really enjoy, those few times that we have each week to talk to a mother who's, just curious about things, has questions, wants to show us something, on her breasts or what have you, real quickly. So I don't know, my day is kind of different every day. We never know what's going to happen. You just have to be prepared for the day. And it's been a wonderful choice for me.
Great. Thank you so much, Sonia. I know for sure that students rave about their, they spend a 4-hour stint at the milk bank as part of the practicum experience, and everybody comes back very inspired and ready to open up their own milk bank wherever they are.
Yeah.
Cool. Does anyone have any questions for Sonia right now? We'd love to hear from you. Well, if you can't think of them now, we will work them in at the end. And if Sonia's still here, we can ask her direct, or we can message her later. So at this point, I'm going to introduce Sasha Wright, who is also a graduate of the PSU lactation program. And she's both an IBCLC as well as a certified postpartum doula. She works with Bridgetown Baby, a local doula practice here in Portland, Oregon. She was born and raised in the UK, has been here for 13 years and has 4 young adult children and her husband. So Sasha, so glad to meet you, and we'd love to hear about your story to becoming an IBCLC.
Hi, everyone. Yes, as Michelle mentioned, I work for doula agency Bridgetown Baby. So I am an independent contractor as a doula and a lactation consultant. But the last year I've taken on a new role. So I am now take care of the admin. I'm the family care director. So I take care of booking all the lactation consults, all the admin. So it's kind of like evolved. So I do a little bit less on hands care now. So the way I got into it was obviously 4 children. I had a terrible time with my first baby and my 4th, which I'm sure that's how most people get into it. So I got as much help as I could, and then I decided I wanted to do the same thing. So I became a Lactation leader, and that's how I got my experience, same as Aria. So I believe that's pathway 1. Forgive me if I'm wrong. So that's how I got my experience, and I did my education at PSU with Dixie. And then it's hard to get into this private practice, so I decided I was going to train as a doula as well. And so I met Bridgetown, and they took me on as an IBCLC and doula, and it kind of works really nicely hand in hand. And the thing I really love about it is just like, especially when I'm doing doula work and the lactation, is you get to spend so much more time with the families. And that's like my favorite part of it. So a typical day for me, I guess, is I spent a lot of time at home on the computer booking in consults. We've just started contracting with the Lactation Network, and that has brought in so many more clients. So I have a team of 5 IBCLCs. So it's a little bit different where it's just not one person. So we are a group, and everybody is an independent contractor. So I will figure out who is the closest, who has the most availability, and then I will send the lactation consultant out to them. So that's most of my day, booking consults and booking doula work. And so I spend a lot of time on talking to the clients, seeing where they are, how soon they need the care. That's what's great about being an IBCLC to start with. It's like I can figure out who needs that care urgently. You know, if I get a family in with a 1-day-old baby, we're going to try and find them care as soon as possible. Whereas if just have someone calling me who's got maybe a 2-month-old, few problems there, we can maybe wait a little bit longer. So that's what's kind of nice being the IBCLC as well. Then the other thing we have at Bridgetown, which is like really phenomenal, I love, is we have something called Danish doula package. So it's like you get an IBCLC visit, and then you get 2 follow-ups, and then you also get doula hours as well. And that's just like my favorite thing to do, because you're there for like 4 hours in the daytime, so you can like see 2 feeds, not just, and you don't feel so rushed, and you can like go over like baby wearing and just like all those other things, reassuring a family of, you know, just what they need to be, you know, how to help them, just make them see that they are doing such a fabulous job. Whereas like in a hour consult, sometimes I feel like it's a little bit not rushed, but can't always cover everything you can. But that's what's also great about now we've got the Lactation Network. They get 6 visits covered, so that you don't, it's like great. So you know you can go back in like 3 days and do another consult, and they get 6. It's wonderful. It's like been the best thing for us. And even if they need more, we can still push back through to the insurance, and they will get them some more care. It's great. It's fabulous. I really like it. So yeah, and then if I have gone out and done a lactation consult, sometimes it's usually only 1 in the daytime I'll do, but then I come home, I have to do all the charting. So there's all that extra work to do on top. It's not just like going to the visit, you come home, you have to do the chart, then obviously send that to the family. So there's lots of behind the scenes work that I didn't really anticipate, I guess. Like maybe you're in a hospital, you're kind of doing it while you're on the clock, but I find, yeah, with private practice, you're coming back later and you're doing all your charting and all your follow-up. And so you've got all that extra work to do on, it's not really on your own time, but it's kind of you're back home for the day and then you do all those extra bits. I made some notes here. So what skills are necessary for my job? What as I said earlier, it's like understanding the lactation support was really key to me doing the job I'm doing now. I think just knowing how urgent care is and knowing which lactation consultants are the best ones to get out, who's got this certain kind of experience. So I think that's really helped. And then for private practice, I really feel like you've got to be driven and you've got to be a motivator, and you're motivated and wanting to like network. It's like, it's not going to happen, I don't think, by just like, I think I need someone to do it all for me. So that's why I like being part of the agency. It's great because the work comes in, whereas I don't think I have the drive to be in private practice. Whereas Robin, who came through, you probably all know Robin Nunes, she's fantastic. She came through the same time as me and she's just taken off with her private practice. She's like really driven to do it. So I do think for private practice, you've got to be very self-motivated. But the agency is brilliant. I love like this little kind of in between. It's a really good way to do it. Yeah, and it's hard because you've got to get out you've got to be out in the community. You've got to get to know everybody. I feel like I know a lot of people, but I just don't think I could run my own private practice. I think there's a lot of because I see all the paperwork that has to get done, because I guess I do all the paperwork for the lactation consultants. It's great. I file everything to TLN. I do all the make all the charts for the lactation consultants. I like to make it as easy for group. They literally just get given a chart and they go out and stuff, and then I do all the filing and all the boring paperwork, which I love. I don't know why, I just love admin. It's great. So that's the things I like most about my job. What do I like least about my job? I think it was driving around for home visits. I love that. It's just like just being like going all over the cities. I mean, it's not so bad now. I feel like the traffic's calmed down, but having to go across the east side to the west side was just not for me. And like I like to keep it local. So I think if you could have like your own office, that would be amazing. Just people coming to you. But other people like driving around and getting to, especially if they're savvy, like planning out. So that's definitely my least favorite. And like I would, anybody wanting to get into lactation as a private practice, definitely get out there and get yourselves as much exposure as you can, talking to those healthcare professionals and networking with as many people as you can. I just feel like that is key. And if you want to be a doula, that's also an awesome way to get into it as well. It's kind of another way to just be working with families. It's we have many IBCLC doulas on our team, and it's like, it's great. You kind of get to do a little bit of both. I think I like the doula work a little bit more now. It's kind of like my preference. Is there any questions, like anything else you want to know?
Yeah.
Like I kind of rush through things.
No, you did great. Yeah, does anyone out there, I think there was at least a couple doulas that came tonight. Does anyone have a specific question about what it was like to transition, or how do you turn off your doula brain and stop vacuuming and just realize, okay, I'm only here for lactation right now?
That is really hard, like wearing the different hats, knowing where to draw the line. You have to like go, okay, like if I'm just doing doula work, I really have to encourage the family to book a lactation. Haven't got, because it's just easy to kind of offer your opinion.
Right.
And it's like,
Right.
you just say, oh, maybe do this. But then I was like really cautious because they may be working with a different lactation consultant, and obviously don't want to contradict what they've been given by somebody else. So it is kind of tricky doing the both. So I do have to make sure I'm very like not crossing the line over, and just like giving basic support as you would as a doula, making sure I'm staying in that scope of practice.
Lovely, lovely. When you said that about the Danish doula package, a few years ago, we had a coworker who she had a grandchild born in Scandinavia. And then, you know, the usual grandmother thing, she flies out there for 2 weeks, but then she said, I didn't have to do anything. All I got to do was, you know, just the grandma role, that somebody else was coming to do all the fun stuff, or not the fun stuff, exactly.
I know.
I was just saying, Jezreel was wondering which pathway you did.
So I think that is pathway 1 was the one I did. So I had, if you are a peer supporter, but I'm not so I think you have to do hours for hours now. When I did it, you were allowed 250 hours per year, or is it 500? I can't quite remember off the top of my head. So I was very fortunate, but I believe now pathway 1 wants exact hours. Every hour you do is like 1 hour, whereas they just gave you a lump sum each year. So it made it easy. I'm not sure it was necessarily the best thing, because I think I really wish I had done the practicum and got some more experience, some more hands-on experience. But I've had plenty of opportunity to gain experience with everybody on my team has been very helpful, and that's been good.
Great, thanks. Let's see, anyone else have any questions? I think I should call up our 4th speaker for the night. Thank you so much, Sasha. It was a pleasure to hear about Bridgetown Baby and your role there. And we all should learn more about the Lactation Network. That sounds really intriguing. So next up, we have Aria Baker, who began her breastfeeding support also as a LeLeche League leader about 20 years ago. And she currently serves as a Clackamas County WIC lactation consultant and the breastfeeding peer counseling coordinator. Aria, we're so glad to have you.
Thank you so much for having me. It's great to see all of you and a lot of my friends from WIC, LeLeche League, the Milk Bank. Super exciting. Thank you for this opportunity. So I started my interest in lactation, like other speakers have shared, after the birth of my first baby. I have bachelor's and master's degrees in science fields, but not medically related. And so I was kind of planning a different type of career. But then I had my first baby almost 20 years ago now. And she went on to be a very, very successful breastfeeder, but we had a couple of hurdles at the beginning, and I actually got on WIC at the time to get breastfeeding support. And that was an amazing experience. And now I've gone on to work for WIC. So that was a great kind of full circle moment for me. But at any rate, my experience with her and then her sister a couple years later, again, another really successful breastfeeder, those kind of launched me into an interest in supporting other parents as they start off with their infant feeding experiences. So I started volunteering with LeLeche League, and that was almost 20 years ago now. The time just flies. And then I did become a lactation educator, and then I took the IBCLC exam for the first time in 2009. And so that will be 14 years this year that I've been in IBCLC. And I think they've changed things a bit. I've recertified a couple of times now, including once by exam. So I think that might have changed as well for all of you. I'm hopeful because studying at that 10-year mark again was basically like just the stress all over again. Even though you've been working in the field, I think you just put a lot of pressure on yourself to take that exam again. So Dixie and Michelle are the experts on what the current status of all of that is. But at any rate, I have been for 13 years, 14 years later this year, the lactation consultant and breastfeeding peer counseling coordinator at Clackamas County WIC. So Veronica shared a little bit about her experience working at Multnomah County WIC. And then I know Shelby is a peer, she said in the notes that she's a peer counselor at a different WIC agency too. So tonight we have representation from 3 of the 5 WIC agencies in Oregon that have a breastfeeding peer counseling program, which is super cool. And so the 5 agencies all have special funding to provide kind of an extra boost of breastfeeding support at their WIC agency. And so those programs are led by an IBCLC, and then depending on the overall caseload of the WIC agency, they have like a subset of that caseload that is on their breastfeeding peer counseling caseload. So again, the program is led by an IBCLC, and then the program, depending on their funding and their size, staffs the rest of the program with breastfeeding peer counselors, of which Shelby mentioned that she is one of those. So that's super cool to have her here as well. So I've been coordinating that program. We're headquartered out of Oregon City at Clackamas County, and it's been an amazing experience. I'm so thankful for that role, starting back when I was a mom with a newborn on WIC back in the day myself, through now having been doing this job for many years. It's just an amazing opportunity. I'm so thankful to have been able to serve so many families. So I think a little bit in the day in the life of what we do at WIC. Veronica shared a bit about WIC, what type of a program we are. In Clackamas County, her caseload in Multnomah County is huge. Ours is more around 5,000 participants in a year. And then our breastfeeding peer counseling caseload is a fraction of that, and it's usually around 250 participants. So myself and our bilingual peer counselor serve those families. The focus of the breastfeeding peer counseling program at WIC is on prenatal relationship development and education, so that we can help people with their infant feeding decisions before they're actually holding that baby. Of course, we have families that don't come on WIC until after they've had their baby, and that's fine too. We still serve them. But the original goal of the program really is to do as much as we can prenatally and help them as they're making those feeding decisions. And so we do education sessions depending on the agency and whether or not we're in the middle of a pandemic. Some of those sessions are in person. Some agencies are doing them remotely now. But we have certain contact intervals that we reach out, of course, more intensely right after delivery, so that we can really provide that support when they might be experiencing some of the more challenging times. And then we continue to serve them throughout the course of their breastfeeding. I think as I was looking at those kind of questions, I thought one thing that jumped out to me about what I just absolutely love most about my job is that we serve families all the way from when they get pregnant and we start talking to them about breastfeeding, all the way through weaning. And so we're seeing conversations around returning to work, and we're seeing conversations about teething and just the entire span of breastfeeding. And I just really love that. I think it's an amazing opportunity to work with those families the whole time they're feeding their babies, and then they come back again on their next baby. So it's a real privilege. I noticed one of the questions, and I wanted to make sure I mentioned when you asked what would people be surprised to know about my job. And I wanted to say, I think that the medical side of our training as IBCLCs is so important. But I also wanted to say that I think a big part of what we end up doing is becoming cheerleaders, basically, advocates, encouragers, those type of things. And, we learn really quickly that it's not about us, how long we breastfed for, how long our neighbor breastfed for, or anyone else that we've ever met. It's really truly what that particular family's goals are and what we can do to support them. And so I think that encourager role, that, one of the most important things that I think of when I think of our staff at WIC is our listening skills. And I think that's vital for IBCLCs. And so again, the medical knowledge, amazing. And of course, is a huge part of the foundation, but we're cheering people on, we're helping them be their best selves, making the healthiest decisions for them and their families, and being really, really great listeners, because we start there with what their goals are, and then we go from there. So those are a few of my thoughts I am so sorry to hear, Desiree. I think that you said that you or some of your peers had somehow tried to contact me or one of my coworkers at Clackamas County WIC, and that makes me really sad that you guys couldn't reach us. So like Veronica said, Multnomah County, we also are super short-staffed. We actually don't currently have the staffing available to answer live phones. So all of our phones go to voicemail and then we return those ASAP. But I'm still really disappointed to hear that. I guess all of our voicemails should be being returned. So I'll go ahead and drop my email and my phone number in the chat there. If you have any questions for me, I would love to answer those here now or in the future. So don't hesitate to reach out. Yeah, congratulations on your journeys ahead.
Well, thank you, Aria. I don't think that, there's a lapse in like phone numbers that used to exist pre-COVID. There's stuff like that we learned through the process that, you dial 211 and you get the WIC breastfeeding counseling service. And then we learned, oh, that doesn't exist anymore. So things like that are still out there and available, but it was more of a process, and it was really good for us to learn what doesn't work and what does, and which email addresses do work. So we did find some of the resources. It just, there were some hurdles to overcome. And I can't imagine how, breastfeeding mothers feel when they're in distress and worrying about feeding their baby at any given moment might feel, and that's under those circumstances. But that's why we had to do the research, so we could figure out how to better serve our community.
Yeah, okay, thank you for clarifying that. I feel a little better, but I still want to make sure that we're able to be reached. And that reminds me actually of to share with you, Michelle, do I have maybe 1 to 2 minutes to share really quick okay. So at WIC, our population tends to be at times younger, and a lot of our participants are not interested in phone calls, and probably the least amount of our work is done by phone, and our population prefers text messaging and virtual appointments predominantly. So we are doing most of our work over texting, and we have a special HIPAA compliant texting program that we use on our computer. So we're typing, but it arrives to the family as a text message on their phone. And so our families are really well looped into that. We have one line at Clackamas County WIC that's for breastfeeding, and the other line is for like WIC appointments, questions about their benefits, their e-WIC card, shopper education, their appointments. So our families are very dialed into that, but someone from the outside would not have access to that. That's just specific to our participants. So I appreciate the opportunity to explain that, and I would love to speak with Desiree or anyone else in the future about what we do at WIC as well.
Great. Well, thank you so much, Aria, for opening our eyes up to the Clackamas County WIC program and how it works. And our last, but certainly not least speaker is Emily Wheeler, who has a BSN and has a RNCOB behind her name, as well as an IBCLC. And she's worked as a nurse since 2014 at a rural critical access hospital in La Grande, Oregon. For those of you coming from out of state, that's about, I can't remember how many miles from here, but it's much more rural than where we are right here. She completed her initial lactation education through PSU in 2019 and certified in the next year. And she used Pathway 1. And in 2020, she got a lactation program off the ground at her own hospital and has worked there ever since. So Emily, please tell us your story.
So I love listening to everybody else's stories. This has been fun. And I apologize for the darkness in this room. I feel like lighting for Zoom calls is always terrible for me. But so like Michelle said, I've worked at a rural critical access hospital since 2014. We have about 250 births a year, just to put that in perspective, pretty small in the scope of things. So the way it works when you're in that kind of a facility with that kind of volume is sometimes it's feast and we're full, and sometimes we might be closed for a week and not see anybody. And that's how it kind of works with lactation there also. I mean, there is definitely an ebb and flow to it, just like with labor and delivery. So I decided that I wanted to pursue becoming an IBCLC. I already worked in the obstetric space, and at a small facility like that, we do everything. We do triage, labor and delivery, postpartum, all the whole gamut. So I kind of, I guess, had always had it in the back of my mind since I went to nursing school. I did a rotation at St. Luke's in Boise, and there spoke with the lactation consultant there, and was just found that very interesting. And what an awesome thing to help feed babies. That's just so cool. And at that time, when I first became a nurse, I had one child, and then shortly after I became a nurse, also I had my second child and breastfed both of them, and had my own little challenges in that, and just thought, wow, that would be a really fun thing to do. I guess I've always had interest in OB, and in working in that area, especially in the kind of place that I am, we didn't have a whole lot of support resources for people. At the time that I had my daughter, which was 8 years ago, we had a nurse who was on the verge of retirement, who was working at the pediatric clinic that we have here in town, that would see people for lactation. She wasn't an IBCLC, but she had done some education, and she would help people. And she was really it for breastfeeding support. So we didn't have an IBCLC here in La Grande, in my city. There was a couple, if you were willing to travel an hour or so to get to some support. There were a couple people that had at other small hospitals that had certified. So I decided to pursue it for that reason, because I guess I worked night shift for a lot of years. And if you have somebody with breastfeeding problems on night shift, it makes for that's what you're doing all night long, is you're at the bedside helping with breastfeeding. And I thought to myself, you know, I just think we can do better. I think that there's more help that we can provide people if we're all really well educated. And I had kind of just the experiences that I had myself, and what I learned from, you know, doing that work, and the extra education that I sought, and my coworkers and their experiences being, you know, labor and delivery nurses. And that was kind of, you know, I just felt like, you know, this would be really great if I could just expand my knowledge here. And I didn't really necessarily intend to be doing it all of my time. But when I certified, we kind of got a little coalition of community members from our Babies First program, and some other local organizations. We got some grant money. We got, you know, just everybody was in support of, yes, this is something we need here to be able to offer this to people. And so we got it off the ground, and I work part-time 2 days a week, seeing inpatients and outpatients. So usually I come in the morning and get report with everybody, and then do rounds with inpatients. And especially if I have a lot of open availability in my schedule, I'll sometimes be spending a lot of time in the room helping with feedings and doing education. And then also just taking outpatients, sometimes for prenatal appointments, most often for postpartum appointments when people go home, which is awesome. And the thing that I really love about that is just getting to follow people, especially if they are having problems. You know, sometimes we'll have several visits and we get to know each other, and it's really awesome to help people meet their goals and to help see people's confidence grow. It's fun to see that when moms are confident and they're like, I got this now, you know, like I'm good. So that's probably my favorite part of it. And and I still love working on the floor just as a nurse, labor and delivery, postpartum. So I do that here and there, and I'm able to help when I'm available, and also do things like I talk at prenatal class and supervise our staff education for the breastfeeding and just infant feeding component. And yeah, that's it in a
Great.
nutshell.
Thank you, Emily. Would you have any, we don't have a clear sense if there's anyone else from more, less metropolitan areas, but would you have any words directed to people that live in a less populated area?
Yeah, I think that networking is really important, especially in smaller areas, because you have to really, like, you know, I know my people at the Norco that fills scripts. I know my WIC people. I know, you know, my baby's first ladies and all that sort of stuff, and just kind of having those connections so that you know also where you can send people to if they need other resources, and also so that people know who you are, so that if they're helping someone that needs your help, that, you know, you all kind of have that relationship established. So I think that, and then also just, you do have less opportunities for experiences in a smaller area, just because, like, volume.
Mhm.
So I do think I certified through Pathway 1, and I wished that I would have had the opportunity to do something like a Pathway 2 program. I just thought, man, that would have been so awesome to go get to spend time with people who do this all the time. So I really think for people who are not, like, for people who have the opportunity to do something like a Pathway 2 or a Pathway 3, I think that that's awesome. It's great that we're able to certify through Pathway 1 and have that available so that there are more IBCLCs. But I just think if you get whatever experiences you can, like, I've sought those out on my own and have done a lot of extra things to be able to give myself, you know, those extra bits of kind of tying things together through the years. But I think that's an awesome thing that PSU offers. And I personally, when I did the program through PSU, I did the hybrid program that was online, but also in person. And I loved those in-person weekends. Those were my favorite part of the program by far. So I think doing it that way just gave you I just think that's so much better than doing everything all online. If you have an opportunity to go meet with people and you know, hear other people's stories and kind of get to know people.
I mean, you almost realize, like, that we are also like our own support group, right? And we speak the language, and you find that with each other. So Kayla is a doula turned LNDRN, and she is wondering, what's the hardest part of your job, Emily?
The hardest part of my job, there's always politics that come along with working in a hospital setting or working closely with different providers. And I think I wouldn't say it's just a challenging piece of it, that you have to really just use your communication skills and advocate for your patients and know, you know, standards of care, and be able to not be afraid to speak up if there's something that you don't agree with or aren't comfortable with, or just feel like, you know, this patient needs for you to know this information. So that's, I think, the most challenging things is just the relationships, but that's all, you know, part of when you're in that space, you know. Because of the way that I am set up, I know my doctors, and I'm always you know, communicating directly with them. So it's a little different, whereas, you know, you're not just writing a PEDS report and sending it off.
Right.
There's usually a back and forth conversation and things like that. But there's also good things to that, because you can educate people and they know to ask use about certain things as well. So they might come to you and want to be educated about certain things, or know that you would be the person to answer certain questions. And so there's a back and forth of just, those relationships.
Definitely. Great. Do you want to do the other part of Kayla's question was anything that has surprised you? Does your back hurt? I work with some nurses who say, oh, I can't do lactation support because you're just always bending over. Like, oh, that doesn't feel like my whole day, but go ahead.
The way that I wouldn't say my back ever hurts doing lactation. If anything, I feel like when you have worked labor and delivery and held legs while people are pushing for hours, that kills your back. But no, I get myself comfortable. I'm like, I'm going to be here for a while. So let's sit and chat. But I think the surprising thing to me, I think, is in the setting that I'm in, is when you do have that background knowledge, how surprising it is the lack of knowledge there is out there in a lot of healthcare providers. I think that's the most surprising thing to me still to this day. It's like you're always trying to make sure that you're educating the people around you too, so that we can all provide the best care. But I think that is always a surprising thing of like, why don't they have more education about breastfeeding for physicians and for, nurses? Because really, unless you seek that on your own, it's pretty minimal.
Right.
So you're constantly just trying to impart what you have also to help the overall, learning of everyone.
Yeah. Well, thank you so much for that. Okay, so it's 8:20 and we'd love to sort of open up the discussion if anybody has any specific questions or just wants more information. This is your time. Next week, we are having a little information night about Pathway 2. It's going to be pretty specific to folks who are kind of ready to go. So maybe further along the line than some of you are, but you are more than welcome to join us for that. Go to our website for more details, and I will also drop back in our where to ask questions. Let's see, how about this? So that is our email address. And we meet with students all the time to address these exact kind of questions about what pathway might be right for me. So we so appreciate you being here tonight, both our speakers and all the attendees.